So before we talk about white blood cell count and then the differential, the percentage breakdown of that, just to kind of review, a complete blood count includes the red blood cell count, hematocrit, hemoglobin, white blood cell count, the MCV, MCH, MCHC, and RDW, and that kind of gives you an idea about what the cells themselves look like, the red blood cells. Platelets and then the mean platelet volume, and then also they'll smear the blood and they can look at that under the microscope and see if there are any abnormalities. So now that we've kind of reviewed the CBC in general, I mentioned that one component of the CBC is the white count. And so a normal white count, if you look at the table there, it'll tell you the normal count is 4,000 or 5,000 depending on the source to around 10,000. And it's measured as per 1 millimeter cubed of blood. So if you took a millimeter cubed of blood and you counted the number of white blood cells, that's how many you'd find. So if we don't do a differential and we just look at the white blood cell count, that should be between 4 to 5,000 and 10,000. If, though, we do a differential, which is what you will typically see, you're going to see it broken down into the 5 major types of white blood cells: neutrophils, lymphocytes, monocytes, eosinophils, and basophils. And then you also see a percentage. So the percentage is just the percentage of each type of white blood cells that are in that same 1 millimeter cubed of blood. So the absolute number is the actual count. So if we looked in a microscope, for instance, and we had this millimeter cubed of blood, and we counted how many neutrophils there were, how many lymphocytes, how many monocytes, how many eos, and how many basos there were, that would be the number. Percentage, though, would give us, well, the percent out of the total. And I'm going to, in the next slide, I'm going to actually kind of draw out 2 examples and show you why the number and the percentage matter. You know, why we don't just report one or the other, because truly the percentage can help us sometimes see that there's a problem, but at the same time, the percentage does not tell the whole story, and we have to have the absolute count or the number in order to really understand what's going on with the patient. So that's what we're going to talk about now. So now I'm going to explain why the count or the number and the percentage in the white cell differential matters. Okay, so I'm going to illustrate here. On this left side is one patient, on the right side is a different patient. And so we're going to say that this first patient has 3,600, excuse my kind of big numbers here, 3,600 neutrophils, which ends up being around 62%. They have 1,600 lymphocytes. Okay, that ends up being around 27%. We're going to say they have around 500 monos, which is around 9%. Eosinophils, they have about 80, which ends up being 1%. Basophils, they have 40 for the count, which is also 1%. Now, these are rounded percentages, so that's why, you know, when you have an 80 and a 40, they both show 1%. So anyway, we're going to say that's a total here, if we add that up, to 5,820. So 5,820, and of course our percentage is going to add up to 100. So that's all normal. If you went back to the previous table, you would see that all of the numbers under the count column are normal for each of their respective white cell types, so neutrophil, lymphocyte, monocyte, eosinophils, and basophils. And if we look at percentage, it's the same thing. All of those percentages fall in the normal column, and our total count is normal. It's between, and again, it's 4,000 or 5,000 to 10,000, depending on the source. That 4,000 to 5,000 changes. And then, of course, like I said, 100%, because you're always going to have to add up to 100%. So that was patient A. If we have patient B on the right here, though, what I'm going to do here is say that they have 744 neutrophils, 324 lymphocytes, 108 monocytes, 12 eosinophils, and we'll say 11 basophils. if we figured that, we're going to see that they have 1,199 total cells, total white blood cells. That's actually a critical value. And it would mean that they have severely low levels of white blood cells. This would be a major problem. But if we look at the percent column, we'll see that it's 62%, 27%, 9%, 1%, and roughly 1%. And again, this is all rounded. So what we see here is that the difference is really in the total count. Either 5,820, which is perfectly normal for a total white blood cell count, and 1,199 as a blood cell count. So our percentages are the same on both sides, but our count is different. And since we've identified that our count is different, it really illustrates why we have to see both the count or the number and the percentage anytime we have a white blood cell differential. Because if we don't have both pieces of the puzzle, we really cannot see the entire picture. So here I illustrated how the count can be different and the percent can be the same, but I'm also going to demonstrate next how the percentage can tell us information and really give us some valuable clues as to what may be going on with a particular patient. So now that we talked about the count and percentage and how we have to look at the count because the percentage can be misleading, I also want to talk about how the percentage can help us as well. So this patient, we're going to say, has a neutrophil count of 3,600, lymphocyte count of 1,600, monocyte count of 500, eosinophils at 1,200, basophils at 40. And these are the same numbers that I used actually in the last patient, patient A, except for the eosinophils. The eosinophils in the previous patient, on patient A, had 80. This time we're up to 1,200. And so that's going to give us a total of 6,940. Now, if we look at the percentage, it's going to tell us we've got 52, 23, 7, 17, and 1. Now, if you mark the ones that were abnormal, neutrophils would definitely be abnormal here. They'd be just a little bit low. And eosinophils would certainly be high, and that's the one that really sticks out. So if you were going to look at a patient's lab results, you would see that the neutrophils and eosinophils would be flagged because the percentage for both of those was high, or for neutrophils was low, for eosinophils was high. And it's considerably high for eosinophils. Remember that the normal neutrophil percentage, you're talking approximately 55 to 70%, somewhere in there. And again, the source for any lab values does change somewhat from lab to lab. Not largely, but in some ways it will. So what that tells us is we need to look at what things might cause, and again, if we look at the total count, 6,940 is in our normal range of total white blood cells. But if we look at our percentage, we have the abnormalities. And also the eosinophil count. 1,200 is most definitely high for eosinophils as a count as well. But if you look at what will cause changes for this elevation in the eosinophils that we see, high eosinophil levels we usually will associate with parasitic infections, sometimes allergies. So a patient that's got pretty severe seasonal allergies will have elevated eosinophil levels. And at this level, we would be concerned that there could even be a parasite of some sort. So I'm just going to quickly review what we may see. So an elevation in or a decrease in each of these. So in neutrophils, if we see the increase, we tend to think of that as an infection, maybe a bacterial infection. So we'll say a bacterial infection. And trust me, there are a ton of things that may cause increases and decreases. I'm just going through some of the most basic things right here. And a decrease can really be anything. It can be a bone marrow issue, and can be a result of a treatment for cancer, for instance, when it suppresses the ability of the bone marrow to, and kills some of the ability of the bone marrow to produce white blood cells. And those are just two things there. Lymphocytes, we a lot of times will associate an increase in lymphocytes with a viral infection of some sort, and a decrease may be a leukemia. Monocytes, we also may see this with a viral infection. We can see this with parasites, though. And a decrease, it depends. It can be certain kinds of leukemia. Sometimes you will see this with prednisone. So I'll say, leukemia, and if they're taking prednisone, it can also cause a decrease. Eosinophils, I mentioned an increase. We think allergy, and we may also think parasite. And a decrease, where there's really nothing that's common that we would see a decrease in eosinophils and make us think that there was any certain thing going on. And basophils, an increase may be a result of leukemia, and a decrease, sometimes hyperthyroidism or stress, and then also an allergic reaction. So allergic reaction is the one I usually think of, and then also the hyperthyroidism. So again, as kind of reviewing what we're talking about here, while the count is important, the percentage also does help us sometimes. In this case, it flagged that we were a little low on neutrophils, but really the important thing that we have to look at there is, even though that it was telling us, the computer would flag this and tell us that the neutrophil had an abnormal result, but if we look closely, we would say, okay, a count of 3,600 neutrophils is perfectly normal. And your normal neutrophil count is anywhere from 2,500 to around 8,000 even. So 3,600 is normal. So we're not really too concerned about that 52%. But when we get down to that 17%, which is flagged, we say, okay, what is a normal eosinophil count? And if we looked at a normal eosinophil count, that's 1 to 4. So 1,200 is extremely abnormal. It's high. And so if we looked at what might cause that, we'd probably be thinking allergy or parasite at that time. So again, very important, anytime we look at the white count differential in a CBC, we look at the percentage and the count, or the number. And we want to compare that. We don't ever want to say, just because all of the percentages are fine, that the person is perfectly fine. Because if they're getting treated for cancer, for instance, they may only have a white count of 500 or 1,000, which is very dangerously low, and exposing that person to any sort of bacteria or virus could result in severe illness and death even. So we can't be comfortable when we see a percent differential that's normal. We have to make sure that the count is also normal. But if we do see an abnormal percent, that's when we can look at the count and say, is this really an abnormal count, or is this being thrown off by, as in the case I just illustrated, one of the white blood cells, in this case the eosinophils, was grossly abnormal, which caused some of the other percentages to be off, even though their count, in this case neutrophil, was fine. Hope this video helped, and if you have any questions, feel free to post them underneath this video, and I will hopefully answer them as soon as possible. Thank you for watching.